Welcome to Lux Scout Psychology. Life can be unpredictable. Sometimes we experience events that are deeply disturbing. These events, whether a car accident, natural disaster, or act of violence, can leave lasting emotional and psychological scars. These scars are not a sign of weakness. They are a natural response to overwhelming stress. Our minds and bodies are designed to survive. When faced with trauma, our survival mechanisms kick in. While these mechanisms help us cope in the moment, they can also lead to challenges later on. These challenges are not our fault. They are the echoes of trauma, impacting our thoughts, feelings, and behaviors. It's important to remember that we are not alone. Many people experience trauma at some point in their lives. Seeking help is a sign of strength, not weakness. By understanding the impact of trauma, we can begin to heal and rebuild our lives. Trauma and stressor-related disorders encompass a range of mental health conditions. These disorders arise in response to traumatic or stressful events. They manifest in a variety of ways, affecting how we think, feel, and interact with the world around us. One person might experience vivid flashbacks and nightmares, reliving the trauma as if it were happening again. Another person might feel emotionally numb, detached from themselves and others. There is no single right way to react to trauma. Some disorders, like post-traumatic stress disorder, PTSD, are well known. Others, like adjustment disorders, are less familiar but equally impactful. Each disorder has its own set of symptoms and challenges. Understanding the spectrum of trauma and stressor-related disorders is crucial. It helps us recognize the signs and symptoms both in ourselves and others. This awareness paves the way for seeking help, finding effective treatment, and ultimately, healing. Post-traumatic stress disorder, or PTSD, is often associated with combat veterans. PTSD can affect anyone who has experienced or witnessed a traumatic event. This could be a car accident, a natural disaster, physical or sexual assault, or the sudden loss of a loved one. The key factor is the experience of intense fear, helplessness, or horror. Our brains remember these events vividly to protect us from future danger. Sometimes these memories become intrusive, replaying long after the danger has passed. PTSD is not a sign of weakness, but a natural response to trauma. One of the most debilitating aspects of PTSD is the experience of intrusive symptoms. These are unwanted and distressing thoughts, images, or sensations that force their way into our consciousness. They can manifest as vivid flashbacks, where the trauma feels as if it's happening again in real time. Nightmares are another common intrusive symptom, often replaying themes or fragments of the traumatic event. These nightmares can be so disturbing that they disrupt sleep, leading to exhaustion and exacerbating other PTSD symptoms. Even during waking hours, intrusive thoughts and memories can surface unexpectedly, triggered by seemingly ordinary sights, sounds, or smells. A certain scent, a particular sound, or even a passing phrase can evoke a rush of fear and anxiety, transporting the individual back to the trauma. Beyond intrusive symptoms, PTSD also profoundly affects how individuals interact with the world around them. Avoidance becomes a coping mechanism, as they attempt to steer clear of anything that might trigger those distressing memories or feelings. This avoidance can extend to people, places, activities, or even conversations that remind them of the trauma. They might isolate themselves from loved ones, withdraw from social events, or avoid situations that were once enjoyable. This avoidance, while understandable, can have significant consequences for their relationships, work, and overall quality of life. It creates a vicious cycle where they avoid reminders of the trauma, but this avoidance only strengthens the fear and anxiety associated with it. While PTSD is classified as a mental health disorder, its impact extends far beyond our minds. The constant state of hypervigilance, where the nervous system is stuck in fight or flight mode, takes a toll on the body. Insomnia becomes a frequent struggle, as intrusive thoughts and nightmares disrupt sleep. This lack of restful sleep further exacerbates other symptoms, leading to fatigue, difficulty concentrating, and irritability. The heightened anxiety can manifest as physical symptoms like muscle tension, headaches, stomach problems, and a racing heart. Over time, this chronic stress can weaken the immune system, making individuals with PTSD more susceptible to physical health problems. In the immediate wake of a traumatic event, our minds and bodies are reeling. The shock can be profound, leaving us feeling numb, disoriented, and struggling to process what has just transpired. It's during this acute phase, within the first month following a trauma, that acute stress disorder, ASD, may emerge. Imagine a sudden car accident. The screeching brakes, the shattering glass, the disorienting impact. These sensory experiences become seared into our memory. In the days and weeks that follow, we might find ourselves replaying the event over and over in our minds, unable to escape the vivid images and sounds. Sleep offers little respite as nightmares intrude, transporting us back to the scene of the trauma. The world might feel surreal, distant, as if we're observing it through a fog. Our emotions might seem muted, blunted, as if we're detached from ourselves and our surroundings. Acute stress disorder shares many similarities with post-traumatic stress disorder, often manifesting with similar symptoms such as intrusive memories, avoidance behaviors, and heightened anxiety. Both disorders reflect the mind's struggle to cope with the overwhelming experience of trauma. However, there's a crucial distinction between the two: the duration of symptoms. ASD is characterized by its acute onset and limited duration. Symptoms typically emerge within the first month after the trauma and persist for at least 3 days, but no longer than 1 month. In contrast, PTSD symptoms can persist for months, years, or even decades after the traumatic event. ASD can be thought of as an immediate, intense reaction to trauma, while PTSD represents a more chronic, enduring pattern of response. While the symptoms of acute stress disorder can be incredibly distressing, it's important to remember that ASD is not a life sentence. It's a treatable condition, and with appropriate intervention, many individuals can experience significant improvement and recovery. Early intervention is key. Seeking professional help soon after the trauma can help prevent ASD from developing into PTSD. Treatment for ASD often involves a combination of psychotherapy, medication, and support groups. Trauma-focused cognitive behavioral therapy can be particularly effective in helping individuals process the traumatic event, manage intrusive memories, and develop coping mechanisms for anxiety. Medications, such as antidepressants or anti-anxiety medications, might be prescribed to alleviate distressing symptoms and improve sleep. Life is full of transitions, both big and small. Some transitions, like getting married or starting a new job, are often viewed as positive. Others, like divorce or job loss, are undeniably difficult. Even normal life changes can trigger significant stress. Imagine losing a job you've held for years. The sudden loss of income and routine can be deeply unsettling, or moving to a new city, far from friends and family. The unfamiliarity can feel overwhelming. These experiences, while common, are not insignificant. We all experience sadness, anxiety, or irritability from time to time. These are normal human emotions, often fleeting responses to life's ups and downs. But when these emotions become persistent and intense, they may signal something more serious. Adjustment disorders are emotional or behavioral symptoms in response to stressors. This stressor could be a single event or an ongoing situation. What sets adjustment disorders apart is the severity and impact of the symptoms. One of the most challenging aspects of adjustment disorders is that they often arise in response to events that are already difficult to navigate. Grieving the loss of a loved one, coping with a major health diagnosis, or rebuilding a life after divorce, these are already emotionally demanding experiences. When an adjustment disorder develops, it can feel like an additional burden on top of an already heavy load. It's crucial to remember that experiencing an adjustment disorder is not a sign of weakness. It's a signal that the demands of the situation exceed our current coping resources. Seeking professional help is not a sign of defeat, but rather a courageous step towards healing. A therapist can provide a safe, supportive space to process difficult emotions, develop healthy coping mechanisms, and build resilience in the face of change. From the moment we are born, we are wired to seek connection. Babies instinctively turn towards the sound of their mother's voice, seeking comfort and security in her touch. This innate drive to form attachments with caregivers is essential for survival. Through these early bonds, children learn to regulate their emotions, develop a sense of self, and navigate the world around them. These early relationships lay the foundation for all future relationships. When children feel safe, seen, and consistently cared for, they develop a secure attachment style. They learn to trust others, to seek support when needed, and to form healthy, loving bonds throughout their lives. However, when these early caregiving relationships are disrupted, the impact can be profound. Children who experience neglect, abuse, or inconsistent caregiving may struggle to develop secure attachments. Their ability to trust, to connect, and to form healthy relationships can be deeply affected. Imagine a child who shrinks away from touch, who avoids eye contact, who seems emotionally distant even with familiar caregivers. This child might be struggling with reactive attachment disorder, a rare but serious condition that can develop in children who have experienced severe neglect or deprivation in early childhood. RAD is not simply a matter of being shy or introverted. It's a profound inability to form and maintain healthy attachments with caregivers. These children have often learned that the world is an unsafe place, that adults are unreliable, and that emotional needs go unmet. As a result, they might resist comfort, affection, or nurturing. They might display a lack of emotional responsiveness, appearing indifferent or unemotional. Their behavior can be unpredictable, switching between withdrawal and outbursts of anger or aggression. In contrast to the withdrawn behavior of RAD, children with disinhibited social engagement disorder exhibit overly familiar and indiscriminate behavior toward strangers. They might readily approach and engage with unfamiliar adults, showing little or no hesitation in seeking attention or affection. While this behavior might seem superficially charming, it reflects a lack of appropriate boundaries and an inability to discern safe from unsafe individuals. Children with DSED might wander off with strangers, fail to check back with caregivers in unfamiliar situations, or engage in overly affectionate or inappropriate behavior with people they don't know. This indiscriminate friendliness stems from the same root as RAD, a lack of consistent, nurturing caregiving in early childhood. These children have often learned to seek attention and affection wherever they can find it, even if it means putting themselves at risk. Both RAD and DSED are complex disorders, often requiring specialized therapeutic interventions. The primary goal of treatment is to help these children develop a sense of safety, security, and trust with caregivers. This often involves working closely with foster or adoptive parents, providing them with the skills and support they need to create a nurturing and predictable home environment. Trauma-informed therapies, such as play therapy, art therapy, and attachment-based family therapy can be particularly helpful. The journey to healing from RAD and DSED is a marathon, not a sprint. It requires patience, consistency, and unwavering commitment from caregivers and therapists alike. With time, with dedicated support, and with the power of healthy, loving relationships, these children can begin to heal and thrive. A multifaceted approach. Treating trauma and stressor-related disorders is not a one-size-fits-all endeavor. Each individual's experience of trauma is unique, as is their journey to healing. Effective treatment involves a multifaceted approach, tailored to the individual's needs. It's like assembling a puzzle: therapy, medication, support groups, to create a comprehensive plan. Psychotherapy forms the cornerstone of treatment. Through talk therapy, individuals process the trauma and develop coping mechanisms. Different types of therapy may be employed. CBT is effective for PTSD, helping to challenge negative thoughts. EMDR uses bilateral stimulation to process traumatic memories and facilitate healing. Building a strong support system is instrumental in recovery. This involves confiding in trusted friends, joining support groups, or engaging in activities that foster connection. Support groups offer a unique space for individuals to connect and share experiences. They can share stories, offer encouragement, and learn coping strategies. The journey of healing from trauma is rarely linear. There may be setbacks, moments when darkness threatens to engulf us. But even in the darkest times, healing is possible. Our minds and bodies possess an incredible capacity for resilience. With the right support, we can navigate these challenges and reclaim our lives. Seeking professional help is an act of profound strength. We deserve to heal, to thrive, to live full and meaningful lives. The journey of healing may be long, but it is worth taking. Reach out, seek support, and embark on your journey of healing today. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.